What? Okay. Have extreme bronchitis and not affect the ability to change this cavity. That's the question. What else? What? Can't hear you. This is a tumor. Maybe. That would be one of my way down the list.
Like injuries to like the ribs or
Injuries to the ribs. How about that girl in the medical examiner's office? She had like 18 inches of extra tissue out here. She can't expand that cavity, right? Very much. But it's something wrong with the muscles, something wrong with the ribs, or there's something impeding. Pneumonia only because it hurts sometimes. It's not anything physically wrong. Well, pneumonia is something physically wrong, but pneumonia is inside the cavity. And it's the reason we would tend not to breathe as deeply because it hurts. So, anything else? How about polio? In some cases, polio affected people, in the muscles in their legs. In other people, it affected what? The respiratory muscles. That's why they ended up in the iron lungs, etc. That's what, they don't have the iron lungs anymore, but they do have kind of compression vest type thing. There was a lady in California a few years ago, and polio. It was these muscles that were affected, the respiratory muscles. And she's hooked up to this chest-like thing, which is electric. It changes the pressure in and out, in and out, up and down, up and down. And that basically expands her cavity, lets it go, and the electricity went off in her house. And she had a generator, and the generator, other than the electricity, the generator failed. And of course she, what? She died within a few minutes because she couldn't breathe. All right. I know we're running a little bit over, but I want to finish all of these. Harmful consequences, not being able to change, well, I think we've got everything. You can't breathe as efficiently. You can't change that cavity, you cannot breathe as efficiently because you cannot create a pressure difference between the inside of the lung and atmospheric. How would you compensate for reduced ability to change the thoracic cavity size?
increase the respiratory.
Breathe faster,
Shorter, deep breath.
right?
Shorter, faster breaths. Take shorter, faster breaths.
Well, you're already taking shorter breaths. Shorter means not as deep.
Right.
And then the idea is faster because you're